So RBC is 4.5 to 5.5 millions per microliter. WBCs are 4,000 to 11,000 per microliter. Platelets are 1.5 to 4 lakhs. These are the standard accepted values as in standard textbooks. Okay. So write these values and microliter, write these values as such. Don't make up values of your own. And in medical science, you will come across so many values and all. Most values will be expressed in a range. Don't say a particular, say RBC is 5 million, not 5 million. It is in a range. It cannot be, it is not possible to be same for every human being or every individual. So it is such and such per microliter of blood. In SI system, it's microliter. So in CGS system, it's millimeter cube. What is your problem? Anything to laugh? If you don't want to attend the class, you may leave. But in the class, you have to maintain discipline. I am telling you. What is there to laugh and talk to the other people? Microliter, millimeter cube is the same thing. What is microliter? We can establish, even we can establish it. That is mathematics. So just know this relationship. This is the conversion. 1 liter is equal to 1 decimeter cube. SI system and CGS system. So from this we can derive microliter is 10 to the power minus 6 liter. Okay, so millimeter cube and decimeter cube. 1 decimeter cube is 10 to the power 6 millimeter cube. That can be established. So cell counts are expressed in microliter of blood. Hemoglobin count is expressed in per deciliter of blood. Okay, theoretically accepted values are 14 to 16 gram per deciliter in males, say 12 to 14 gram per deciliter in females. Okay, so that is how to express this plasma. So what is, we are talking about hematocrit and PCV. Hematocrit is the percentage of RBCs by volume or PCV. As RBC count is much higher than WBC and platelets, the total volume of cellular elements of blood practically is taken as the RBC volume, that is the hematocrit. That is 45% of, whenever we get a practical, whenever we have to calculate something, we take 45% if the blood volume is known, and if we have to take how much RBC volume, we have to consider how much RBC is there in that blood volume. I think very familiar to you, this is not very unfamiliar. WBC is, what are the cellular elements called? The formed elements of blood. Why they are called formed elements? We discussed the other day. Why they are called formed elements? See, before that, plasma 55%, roughly we take it as red blood cells. The cellular elements 45%, but still here also a range is mentioned. These are either what pictures I show for your convenience are either from the internet or from standard textbooks. Remember, you are not allowed to take any pictures over here. This is just for your convenience. Okay. Formed elements, they are called formed elements because not calling them cells, the reason is, one reason is, the single is platelets are cell fragments formed from megakaryocytes. They are not whole cells. So it is better to call them formed elements. They are not fluid components. Fluid component is plasma, non-fluid components, and they are having definite structure, of course, but all cells, as they are not whole cells, platelets are not whole cells, they are cellular fragments from megakaryocytes. So in this case, the term formed elements is better. In theoretical papers, from the examination point of view, you have to face long questions of 15 marks, short notes, short answer type questions, explain why, justification types of questions. So whenever you read a topic, my suggestion is you try to cover, you try to think over what may be the, from the examination point of view, what may be the questions or what may be the explain why type of questions. You go through the past 10 years PYQs, past years question papers. So why are the term formed elements better in this case instead of cells? This may be set as a justification type of question. I am just giving you one example. So these types of questions can be set from every topic. So you will get in the exam long question, short notes. Now they have included from this last 3-4 months and your senior batch, the batch immediately before to you, the 2024 batch appear for the university exam on the basis of the new format. There are some applied short notes, that is clinically oriented short notes on clinical, that means the clinical application of the physiological knowledge. So there will be some applied short notes, there will be some straight short notes, physiology based physiology short notes. There will be justification type of questions, long questions, short questions, and MCQs. Okay, multiple choice questions out of 100. Now they have decided it as there will be 12 MCQs out of 12 MCQs, 12 marks out of 100 marks. This is the for the theoretical papers, both papers, and this is same for I think all the subjects of the, as far as I know, all the subjects of the first phase, anatomy, physiology, biochemistry. Some part of it is plasma proteins. We discussed about those plasma proteins, functions of blood, very easy. Transportation of oxygen and nutrients, main function. It has immunological functions, transport functions, maintaining acid-base balance of the body, homeostasis, and so on. So this you have to, so if you are to write maybe a short note on functions of blood and functions of the individual components, we will come across when we read those individual components. Okay, total proteins, plasma proteins are one section of the almost 90%, more than 90% is water, 6-7% are plasma proteins, that is 6 to 8 gram per dl. See, plasma proteins are again described, the unit is taken as dl. The units are for the units are expressed such that the mathematical figure is a convenient one. Here if we try to express it in microliter, what will happen? The figure will become huge. Instead of dl, if we the figure will become very small. So it will become a fraction figure or a decimal. We have to write like this 10 to the power minus 2, minus 3, some figure will come like this. So it is expressed in 6 to 8 gram per dl. So proteins, plasma proteins are of various types. There are glycoproteins, which are proteins conjugated with carbohydrates. About the glycoprotein, there was once upon a time physiology and biochemistry was the same subject. But here about these glycoproteins, you will be reading it in, studying it in biochemistry. Okay. So, and till now more than 300 proteins have been described in plasma. So, you are not allowed from the next day. Today I am allowing, whatever may be the cause. After 2 p.m. you are not allowed to the class. The plasma proteins, obviously in the embryonic stage, they will be from the connective tissue. Blood is a fluid connective tissue. You all know fluid connective tissues, that is mesodermal in origin. So in the embryonic stage from mesenchyme, in adults, plasma proteins are most of the plasma proteins are obtained from the liver, namely the RE cells of the liver, some from spleen, and some plasma proteins related to the immunity function, gamma globulins, they are from the lymphocytes, one of the types of the WBCs. And lymphocytes again we will discuss, lymphocytes again of T lymphocytes and B lymphocytes. From the B lymphocytes these gamma globulins are obtained. Most of them are plasma proteins, which is the major plasma protein in the body, albumin. Then there is globulin. If you have to write the types of plasma proteins, then mostly we talk of albumin, globulin and fibrinogen. Fibrinogen, you know that it is one of the blood clotting factors. Okay, blood clotting factors, we will discuss about the clotting factors in the subsequent classes. There is one single competency on that, blood coagulation. So I am mentioning the term competency, these are your initial days. Go to CBME 2024, you will find the competencies of the various topics. Hematology like this, for example, blood is, hematology section is PY2, PY2 is hematology. Now there are the subtopics. The plasma proteins are PY2.2. This is just one example. General physiology is PY1, gastrointestinal physiology is PY4. You will find the structured syllabus, what are the topics you are to study, and it is also mentioned which are to be studied in the lecture sessions, which are to be studied in the demonstration sessions. So usually albumin-globulin ratio is like almost 2:1, it's 1.7:1. You see some diseases, these are altered, that is called altered or reversed albumin-globulin ratio. Okay. So that is when you study medicine, you will read about the diseases. So albumin-globulin ratio, usually albumin is greater among the plasma protein, 60% is albumin, so around 30, more than 35% is globulin. Okay. Very less is fibrinogen, these clotting factors, and all the other plasma proteins. So over 300 plasma proteins, and mainly these are the major ones. Globulins on the basis of electrophoretic properties that is their dispersion in when if electrophoresis is done, then according to them globulins are again named in. So there will be various areas in medical science where this classification is made on this basis of alpha, beta, gamma, various areas, alpha, beta, gamma, these are, so all these terms originated either in Greek or in Latin. So alpha, beta, gamma, these are Greek alphabets. So among globulins there are alpha globulins, beta globulins, again gamma globulins are from, as we discussed, just mentioned, not discussed, just mentioned, they are from B lymphocytes, source is B lymphocytes. Okay, so this is the same thing. Fibrinogen is very less. Again, alpha globulin has two subtypes, alpha 1, alpha 2, beta 1, beta 2. Albumin is, if we consider the volume per mass per deciliter of blood, mass of albumin, the mass of plasma protein, 6 gram to 8 gram is the whole, and among them almost 5 gram is albumin, almost 2.5 gram is globulin. Fibrinogen is and other proteins are a very minor fractions of these total plasma proteins. So, and we call, when proteins in blood are less, whenever you get the term EMEA, get acquainted from now on, this term, this suffix, this relates to something, the composition or the quantity of something in blood. So proteinemia means we are talking about how much protein is there in blood, EMEA, EMIA. Hypoproteinemia, less proteins in blood. Hyperproteinemia, less proteins in, more proteins in blood. The upper portion has been cut out anyway, that is not visible anyway. This section, the left section is for some causes of hypoproteinemia, hypoalbuminemia, hypoglobulinemia, where does gamma globulins or globulins, fibrinogen, where they do they decrease, or then the right hand side for hyperproteinemia. All the causes you don't have to bother about just now. When you will read about the various diseases, various conditions, you will come to know about them. This is not an extensively, just a brief list. So this is one from one of the textbooks. Okay, so this is, so like say what happens in burns. In burns, there will be some protein loss. So first there is hypoproteinemia. So in a later stage, due to hypercoagulability of proteins, there may be hyperproteinemia as well. So these things I don't want to complicate right now, but this is just that there are various conditions in the body, just know it for now, where the proteins may be decreased in blood, proteins may be increased in blood. Like in severe dehydration, what may happen? The water portion, the fluid portion may become less and there is a relative increase. So the concentration of any solutes, whenever the fluid portion of some solution will decrease, the concentration of solutes will be relatively increased. So in dehydration, it may so happen in a very dehydrated state, if plasma proteins can be measured, then the concentration of plasma proteins will be more. That is and then that is termed as hyperproteinemia, that plasma proteins concentration in blood has increased. So these are the functions of the plasma proteins, which I have already mentioned. Today also I have already immunological functions. So immunological functions, coagulation of blood, which plasma proteins like fibrinogen and prothrombin. There are others also, defense mechanism of body. Some are of transport mechanism, like albumin itself carries thyroid hormones are carried by albumin. Maintenance of osmotic pressure, you will know about, I don't know whether it has already been discussed in general physiology, diffusion and osmosis, transport mechanisms. Osmotic pressure is the pressure, if you consider a semi-permeable membrane, where due to the difference in concentration of solutes in both sides, what is the semi-permeable membrane in the body? Which is the semi-permeable? All cellular cell membranes are semi-permeable membranes. So from the interstitial fluid, either water may enter the cells, or this fluid may enter the cells, or fluid will pass from the cells to the outside, leading to shrinkage of cells. This depends on osmotic pressure. Osmotic pressure definition is, by definition it is the pressure to be applied to one side of the membrane so that this movement can be opposed. So that is osmotic pressure, that is plasma proteins maintain that is the maintenance of the osmotic pressure by plasma in blood is done by plasma proteins, which determines whether fluid will move from which side of the cell to which side. Blood is flowing within vessels, but from the blood vessels whether fluid will pass on to interstitial spaces, or from the interstitial spaces will enter blood vessels. And also plasma proteins also in acid base balance. So buffering action of plasma proteins are there, like the carboxy terminal, amino terminals are there, which can carboxy terminals will bind to H plus. If there is excess of acids, carboxy terminals to the bases. If bases increase in blood, if the acid H plus increase in blood, then the amino terminals will take. So the plasma protein, it has all protein spins, it is composed of amino acids. So those terminals based on the chemical nature, they will either buffer acids or bases. So that it has a role in regulation of acid base balance. Fibrinogen is about mainly this coagulation. Okay, acute phase proteins, you don't have to go. Acute phase means whenever there is some disease or in the body, any acute reactions in the body, so some proteins are released. So they are called the acute phase proteins. They are the related to these immunological functions of plasma proteins. Some plasma proteins are these acute phase proteins. Like one protein is there, which name we will know later, that is the C protein. Okay, that is called the C protein. There is one plasma like transferrin, transport actions, transferrin, ceruloplasmin, transport of copper, transferrin, transport of iron. Albumin transports not only hormones but drugs, hormones like thyroxine, that is the thyroid hormones. Okay, so there are so many proteins. Lipoproteins obviously transport lipids. Free hemoglobin is transported by haptoglobin. So this is just some few examples. So the transport actions of plasma proteins. So osmotic regulation, as I told, they are colloidal. This will come to know the whole term, colloidal osmotic pressure. So that movement of fluids from within the cells between the interstitial fluid and the tissues. Okay, decrease in albumin level obviously results in whether there will be decrease in albumin level, osmotic pressure will increase and water will go. So loss of water from the blood. So loss of water from blood due to decrease in not only albumin, other plasma proteins also, but albumin they have written because albumin is the major plasma protein, the most in quantity. Okay, and as plasma proteins are amphoteric molecule with a carboxy terminal and an amino terminal, in acidic pH as well as in alkaline medium, plasma proteins can buffer and try to maintain a constant pH. So this is about the acid base balance. Classification of plasma proteins based on the function. Some plasma proteins are classified as anti-proteases. Okay, anti-proteases, because you will get acquainted with these names as the course goes on. Okay, so alpha 1 antitrypsin, again we will read about it in respiratory physiology. Okay, some functions and enzymes. Erythropoietin is one of the hormones. Immune defense, immunoglobulins, other globulins. Inflammatory responses, what is inflammation, you will study in pathology. So inflammatory responses, plasma proteins have a role. Alpha 1 phytoprotein, oncofetal. Okay, leave this. This is not, you don't have to remember everything as of now, whatever is written here, but these plasma proteins can be classified, exemplified according to their functions as well. This is again and from another one of the standard textbooks, foreign author standard textbooks. This is not extensive again, but the list. So there are so many plasma proteins. So you remember for now albumin, globulin, fibrinogen, these names just get acquainted with. Albumin is the major plasma protein. Okay, clinical implications, these have many of the plasma proteins have clinical implications, like we just spoke of ceruloplasmin, it transport of copper. It has a relation to a disease called Wilson's disease. So clinical implications, as you go on studying medicine, you will get mention of these various plasma proteins in various contexts. Okay, so clinical implications, like in chronic infections, gamma globulins will be increased. gamma globulins increased in chronic infections. In multiple myeloma, again on electrophoresis, there is something called the M band is obtained. Okay, due to albumin carries various drugs. So what with when if there are two drugs as we need, albumin carries drugs, not only hormones but also drugs. So if a person is administered two drugs with more or less similar affinity of albumin. So if one drug is consumed earlier, then the binding sites, so without binding to albumin, they cannot work. So already if the binding sites are saturated, then the other drug, it will not be possible to work. These are some clinical implications. So whenever we administer those two drugs together, we have to be cautious as medical professionals. Or we have to think of these things. Okay, so that is the clinical importance. So there will be various clinical, as you go on studying, so you will find this clinical, that means when you study medicine, you will get mention of these things. Why should not we use these drugs together? Also, you will get mention of these things in pharmacology as well. Pharmacology is a subject which is included in your second phase of your medical curriculum. So not a very extensive list, you don't have to know anything, you don't bother about the extensive list, just a basic idea about the plasma proteins and blood and plasma proteins. And today this is already 2:30, so half of today's class is gone. Anyway, I will just discuss those, revise those things for still people are newly joining, that's why. So we will pass on to another topic, that is hemopoiesis. How are blood cells generated or produced in the body? Blood cells. So there is something called I think you have heard of stem cells. So these are the cells of, so these stem cells are multipotent cells. These have potency to generate different types of cells. So hemopoiesis stem cells are undifferentiated cells with the capacity to differentiate and form so many numerous types of cells. Till now, say they are writing 200 types of cells have been identified, and all are from stem cells. Stem cells, a single cell, either the cell can replicate itself so that more cells are formed, or they can give these stem cells can give rise to other cells, other cell types. They may be muscle cells, they may be neuronal cells, there are many cell types, they may be blood cells. So this is just the basic concept of stem cell. They are called stem cells. Stem because from them the other, like from a stem of a tree, the branches originate. So from the stem cell, different types of cells can originate, and even a stem cell can replicate itself. Okay, so stem cells, types of stem cells are totipotent cells, multipotent cells, pluripotent cells. We remember some authors are writing like this, even they are mentioning unipotent cells, but the standard textbooks are writing unipotent, that is same cell type, some stem cell which can give rise to only one cell type, but mostly we talk of totipotent, pluripotent and multipotent cells. These are just terms based on totipotent, like totipotent based on the origin or the level at which they are acting. In the embryonic ability, the totipotent is considered the most potent one, ability to differentiate from the embryonic stage into various types of cells. Pluripotent cells are also similar, but they have somewhat lesser capacity than the totipotent cells, and they are differentiating to pluripotent cells at the level of the embryonic stage, where they are differentiating in the body layers, embryonic layers. Embryology, I think I don't know how much embryology is now covered in the anatomy syllabus, but embryology, these terms or these concepts you will get in when we study embryology in anatomy, give rise to the three germ layers: ectoderm, mesoderm, endoderm. Again multipotent, multipotent is also cells. Multipotent stem cells can divide into various cell types, but multipotent is after the germ layers have formed, after the cellular germ layers are formed, they are called give rise to the three germ layers: ectoderm, mesoderm. They are the pluripotent. After that stage is over, whatever stem cells are there to give rise to the cells of in the structured in a embryo, or the embryo is becoming the fetus, then they are called the multipotent cells. So these I have collected from the internet. They are describing something as oligopotent, unipotent, but these terms are not so relevant as far as the standard textbooks are not writing them. So, totipotent, pluripotent and multipotent. Okay, leave these. These have become, these are same things are written: totipotent, pluripotent, multipotent, unipotent. So, this is the basic concepts. Totipotent is right from the zygote stage, or the zygote becomes the embryo, fertilized cell becomes the embryo. Right from that stage, there are cells. These have the maximum capacity to replicate into any type of cell. Those are the totipotent cells. Then come the pluripotent ones. Then comes the multipotent ones. Functionally, more or less, the conceptually it is the same thing. They have the rise to ability to different types of cells, but at different levels. Pluripotent is at the level of this division of the germ layers, and finally the multipotent cells, like the multipotent hematopoietic stem cells, will give rise to the blood cells, right. So, these are, and we will come across another term called the hemangioblast. Hemangioblast, again, concepts are varying in according to different authors. Various authors are describing them variously, differently. So, hemangioblast, the mesoderm, in the obviously blood is a fluid connective tissue, mesodermal in origin. These things I know. So, we know mesoderm is one of the germ layers in the middle of the ectoderm. Endoderm is the innermost germ layer, ectoderm is the outermost germ layer, mesoderm is in between. So, from the mesoderm, hemangioblast, some authors are writing that hemangioblast from blast cells are primitive or precursor cells, not primitive, precursor cells. So, hemangioblastin, angio, wherever you find the term angio is related to blood vessels. Hemangioblasts, some authors are saying they differentiated into, some cells will be given of endothelial specification. Endothelium is the inner lining of the blood vessels. So, some cells are differentiating into the endothelial layer, some cells are getting the hematopoietic specification, and they are called the hematopoietic, now called the hematopoietic stem cells, embryonically originating from the hemangioblast. Again, some authors are writing that hemogenic endothelium is the same. From the endothelial, first the endothelium is formed, and from there the hematopoietic stem cells are getting originated from the endothelium. So, there are various, some difference of opinion, but ultimately there will be the endothelial cells are separate at the hematopoietic stem cells, which will give rise to the various types of blood cells. Whatever the cellular elements we know of, what is accepted is that there will be stem cells, hematopoietic stem cells, for the differentiation of the different types of blood cells, what we know of blood cells, or better called the formed elements, because platelets, at least platelets are not whole cells, they are cellular fragments. Okay. So, the sites of among hematopoiesis, first we will consider erythropoiesis. Erythropoiesis means generation of RBCs. So, the sites of generation of RBCs, obviously in the embryonic stage, still the organs are being formed. It is from the, again, whatever cells and fluid is there, fluid portion, plasma, cellular elements of blood, formed elements of blood, it will be formed, will be mesodermal in origin, being a blood, being a connective tissue. So, mesodermal in origin from the yolk sac in the first 6 weeks. What is the embryonic stage? From the, in the first 6 weeks, maybe from the blood cells, hematopoiesis starts from maybe around 3 weeks of gestational life. So, from 3 to 6 weeks, it is the mesoderm of yolk sac. Okay, yolk sac, mesoderm. Then from 6 weeks, the fetal liver and the spleen takes over. This is called the hepatic stage. Liver and spleen take over. But this is called the hepatic stage. The term hepatic is related to liver. Spleen is also involved, but the stage is called the hepatic stage. So, when it is formed from the yolk sac, mesoderm of yolk sac, it is also called intravascular erythropoiesis. So, that is, even mesoderm of yolk sac, the hemangioblasts are there, hematopoietic stem cells, from there the blood cells are differentiating. Still then it is called intravascular erythropoiesis. So, the first stage mesoderm of yolk sac, that is intravascular. Whenever the liver, spleen are taking over, so obviously liver, spleen, they are organs, they are not within the vascular system, then it's called extravascular erythropoiesis. So whenever it is from the liver and in extravascular means outside the vascular system, the blood cells are originating from outside the vascular system, bone marrow, from 6 months bone marrow takes over, but liver and spleen tills continues even into the, that means even into the infancy, that means the after childbirth. But the mostly the bone marrow takes over. In the infancy, red bone marrow of all bones, almost all bones, but in the adulthood by 10 years, 15 years, 20 years of age, gradually there is some restriction, like only the, in case of the long bones, only the bone marrow at the ends of the long bones or the vertebra, ribs, sternum, pelvic bones, the sites are limited now in the adulthood. So liver and spleen takes over from the 6 weeks from the yolk sac, but it still continues in the adult life, and even in the infancy, childhood, bone marrow in all bones in the childhood, but in restricted areas of, especially in the long bones, it is restricted to the ends of the long bones in adulthood, maybe around 15, 18, 20 years of age. So not all bones. So same thing. So the RBCs are formed from the at various sites in the various stages of life. Okay. Obviously, before the generation of the organs, it has to be from the primitive germ cells, that is the yolk sac, that is during the first 6 weeks. Just to mention here, you call it single fertilized cell is called the zygote. So from the zygote develops into the embryo. After 8 to 10 weeks, the embryo is called the fetus. So whenever you find the term embryo, whenever you find the term fetus, you just have to play in your head that this is this stage of gestation they are meaning it. So fetal means probably after 8 to 10 weeks of gestation is over. Fetal, whenever you get the term fetus, still then it is the embryo, and the newly fertilized cell is the after the maturation, it is after the combination of the sperm and the ovum, it is called the zygote. So zygote followed by embryo followed by fetus at various stages of the intragestational life. So this is, so hematopoietic stem cells, you don't have to remember everything what is written over here, just to show you that stem cells, there are LTHSC means long term hematopoietic cells, then there are some a term called short term hematopoietic stem cells. These are the various stages in the stem cells. From there the different cells, blood cells are originating. Like these, all these terms are different meanings, like BFU, CFU, these terms will be getting burst forming unit. This word burst means this burst forming unit will give rise to a burst of cells of one type. So BFU, say BFU, where it is CFU MEG. So CFU MEG, এটা কেটে গেছে কিছুটা, উপরের কিছুটা কেটে গেছে, anyway ঠিক আছে, মানে কিছু এই নিচ থেকে কিছুটা বেশি হয়েছে, উপরে কিছুটা কেটে গেছে. Anyway, BFU means burst forming unit for the erythrocytes. CFU MEG, that means colony forming unit of megakaryocytes. So megakaryocytes are the precursors of platelets. BFU, CFU, these terms relate to means these the full forms are burst forming unit, colony forming unit. These are the, all these are precursors to the final cells. For erythropoiesis, we will need from the from the stem cells there is a common myeloid progenitor cells. The progenitor cells are arising from the short term hematopoietic stem cells. So that is CMP is common myeloid progenitor. For the lymphocytes there will be a common lymphoid progenitor, CLP. Okay, so from CMP again MEP is myeloid erythroid progenitor. So from these cells, from these are the stages through which they pass before maturation to the final. So there will be various lineages which will divide from these one source from the long term hematopoietic stem cells, there will be the short term hematopoietic cells, then either they will go to the common myeloid progenitor lineage or the common lymphoid progenitor lineage in the adults, or in fact after the even in the fetal stage, after say 12 weeks or so, it will all these things will be from the bone marrow, from the stem cells in the bone marrow. So for the red blood cell to originate, there are some factors will be responsible at various stages. These factors are mostly cytokines. These cytokines are proteins, they are called cytokines. So these terms are, you will often get across these terms on ion. Cytokines are proteins. So some of the cytokines have roles in hematopoiesis as well. So like some cytokines are called interleukins, and again they have various subtypes. In the process of erythropoiesis, which are needed, cytokines like interleukin 3, and a very important protein for erythropoiesis is, it is termed as such, it is the erythropoietin, where sometimes in standard textbooks it is also written as EPO, but I will suggest you, whenever you use abbreviation in anywhere, you at least write the full, what is the full name of that, at least once write the abbreviation in bracket, and then in your, maybe in your theoretical papers when you write the answer, then you use the abbreviation then onwards, but at least don't start writing abbreviations right from the first word. So once you should mention what is the full form, then write in bracket this is the abbreviation, and then you use the abbreviation in the rest of your answer as far as the exam is, at least as far as the exam is concerned. So this is just an idea that from the stem cells how different lineages are originating. You forget about the whole picture, so the different cells will be originating from the different stem cells. This is the brief takeaway. Okay, so common myeloid progenitors will be there, common lymphoid progenitors for the lymphocytes. From the common myeloid progenitor, the myeloid erythroid progenitor for the red blood cells, and the myeloid erythroid progenitor is also responsible for the ultimate maturation of the platelets from the megakaryocytes. This is about the various stages of the red blood cell. So the first stage is called for the hematopoietic stem cell. The first stage is the pro-erythroblast. Erythroblast is, blast is the precursor, blast cell means precursor cell. For the red blood cell, it will be called the precursor cell will be called the erythroblast. So the first stage is pro-erythroblast. Next is the, see from the common myeloid progenitor, myeloid erythroid progenitor, then the burst forming unit, and from the burst forming unit for the pro-erythroblast, what is needed is the erythropoietin acts as that stage. Erythropoietin is one of the important proteins, which is one of the factors which is helping in erythropoiesis. So most important factor. It is needed at the stage of the conversion of those burst forming units. It will form a burst of red cells to the pro-erythroblast, and then they will pass through various stages like the basophilic erythroblast, that is staining with basic dyes, then the polychromatophilic erythroblast and the orthochromatic erythroblast. Textbooks you are reading, you will find the terms, instead of the erythroblast, normoblast. So normoblast are just, it is better to use the term erythroblast, but normoblast is the term used for the normal types of these erythroblasts. So some textbooks are writing it like that, normoblast, but it is the same thing, and you will find that with the prefixes with them, early normoblast, intermediate normoblast and the late normoblast. Early normoblast is nothing but this, what is actually according to the staining properties is basophilic erythroblast. It is also called the early normoblast. You may find in some textbooks, okay, but the standard textbooks are writing basophilic erythroblast, polychromatic erythroblast and orthochromatic erythroblast. From there the immediate precursor, the reticulocyte, at which stage, all these stages, in the earlier stages the cells are nucleated. These blast cells, the precursor cells are nucleated. From this, just before the formation of reticulocyte, the nucleus is extruded and there is no more nucleus. Okay, this reticulocyte stage is the Anucleated stage. So these are nucleated stages of the formation of the erythroblast. There the nucleus, the cytoplasm goes on increasing, nucleus size goes on decreasing. At the stage of the orthochromatic nucleus, orthochromatic erythroblast, the nucleus is it is described as this term, which means very small, almost obsolete. It is called a pycnotic nucleus at the stage of the orthochromatic erythroblast. Then the nucleus get extruded by the process of exocytosis. Exocytosis is a term which will be mentioned in, if not already mentioned, in the general physiology classes. Exocytosis. Then after the reticulocyte stage, there is already the nucleus is lost. Also the RBCs are not only, mature RBCs are not only devoid of nucleus, also some of the cellular organelles like mitochondria and ribosomes, and it lives for almost, lifespan is around 120 days, almost 4 months or so. So this erythrocyte is devoid of loss of mitochondria and ribosomes. This loss of mitochondria and ribosomes occur after the reticulocyte stage. From the reticulocyte stage, the immediate stage just before the mature cell, which will come into circulation. All these stages are in the bone marrow, then they are coming into the circulation. Before coming into the circulation, the cells lose the mitochondria and ribosomes as well, and just before becoming the reticulocyte, the nucleus is extruded. So these are days of MCQs, that which stage nucleus is lost, at which stage hemoglobin is formed. All these are that means can appear as MCQs. So here you see they have used the term normoblast. So intermediate normoblast, it will relate to which one? This one, polychromatophil erythroblast. At that stage, hemoglobin first starts appearing and then increases in amount. Okay, heme synthesis we will discuss separately. Heme synthesis from hemoglobin synthesis from heme and globin. Iron is required, it will be discussed separately. So all these, the whole stage of erythropoiesis takes around a week. Some textbooks are writing just more than a week. Up to reticulocyte it will take 7 days, and further 1 to 2 days for maturation into the loss of ribosomes, mitochondria and all. Somewhat more increase in hemoglobin, and it will become the final matured erythrocyte, another 1 to 2 days more, and some authors are writing the total process takes around a week. 7 to 10 days, you may write 7 to 10 days, or you may mention 7 to 10 days for the whole of erythrophysis. At these sites, which sites? Yolk sac, in the mesoderm of yolk sac, in the, it is also called, just I forgot to mention that time, where the erythropoiesis is occurring. You will get these terms if you study embryology in anatomy. So some things you have to memorize. Area vasculosa, where mesoderm of yolk sac, in the embryonic stage where hematopoiesis is occurring, hemangioblast, then hematopoietic stem cells, then this whatever the other steps, that is the also called the area vasculosa. So that is for the embryonic stage. Then the liver and spleen takes over, then the bone marrow takes over. Stem cells from the bone marrow coming to the stem cells of the bone marrow, then forming colony forming units, bust forming units, then the more precursor cells under the influence of erythropoietin and some cytokines, like in case of erythropoiesis, one cytokine called interleukin 3, IL-3, interleukin 3. The whole form is interleukin. We will again get these terms in various discussions. Interleukin, IL is a very standard accepted abbreviation, IL. So there are various types, IL 1, 2, 3, 4, 5. IL 3 is needed for erythropoiesis. Erythropoietin acts, what is the role of erythropoietin most at which stage? Stage from the forming the burst forming erythrocytes, BFUE, to the pro-erythroblast stage. Here erythropoietin is needed. At that stage erythropoietin is mostly needed, from the burst forming unit to the pro-erythroblast stage, this stage. See, nucleus is present, exocytosis of nucleus at this stage, then it becomes the reticulocyte, loss of mitochondria and ribosomes, it becomes the mature erythrocyte, and total this process takes 7 to 9 days, 7 to 10 days. So, what are the factors influencing erythropoiesis? The primary factor which we talk of influencing erythropoiesis is hypoxia. What is hypoxia? Decreased oxygenation at the tissue levels, at the cellular level. Okay, there is a common notion that hypoxia is decrease of oxygen at the respiration, at the breathing, in the lungs. No, hypoxia is decrease of oxygen at the tissue level, and this is the most important factor for stimulating erythropoiesis. There is nowadays different factor has been established, the hypoxia-inducible factor, which induces erythropoietin. Erythropoietin's secretion, erythropoietin is a hormone which is synthesized in the kidneys, to some extent in the liver also, but mostly from the kidneys. And for this, hypoxia is the most potent stimulator of release of erythropoietin or secretion of erythropoietin, not only from the kidney, also from the liver, but mostly from the kidneys. And a separate factor has been established or identified, that is called the hypoxia-inducible factor. So, if there is low blood oxygen, the kidneys will produce erythropoietin. Again, if there are increased number of red cells, then when there is increased number of red cells, there is increased oxygen carrying capacity. When the oxygen carrying capacity of blood increases, then erythropoietin secretion is reduced. This is one type of, in the body, many mechanisms work in that way. Whenever something is more, the factor which is responsible for synthesis or for that role, that function, that is decreased. Whenever something is more, something means like increased oxygen carrying, increased number of red cells, oxygen carrying capacity. The function of the RBCs, function of hemoglobin is to carry oxygen. So, whenever there is increased oxygen carrying capacity, erythropoietin secretion is decreased. This is a type of feedback mechanism. A feedback is occurring so that action is not now required. So, this is erythropoietin secretion is decreasing. These are feedback mechanisms. Most mechanisms like this is called negative. This is a type of negative feedback. So, you have already negative feedback mechanisms, positive and negative feedbacks have been discussed in general physiology classes. So, positive feedback means there will be examples of positive feedbacks, various examples, like when during childbirth. Okay, during childbirth, oxytocin secretion is increased. Okay, now whenever oxytocin acts on the uterus of the just would be mother, okay, then more oxytocin is released from the source, that is the posterior part of the gland called the pituitary gland. So, as this process is progressing, childbirth, more and more oxytocin is gained during the labor, during the childbirth. This is a positive feedback mechanism. Not all positive feedback mechanisms are, some positive feedback mechanisms which are detrimental to the body. So, but this just the concept of feedback is, it may be positive feedback or negative feedback. Most feedbacks are negative feedbacks, so that whenever something is more, that is lessened to again maintain homeostasis, maintain normalcy. So, like erythropoietin, low blood oxygen hypoxia, it stimulates erythropoietin and erythropoiesis from the red bone marrow. But whenever there is increased oxygen carrying capacity, erythropoiesis will be decreased. So, factors affecting not only hypoxia, other factors affecting erythropoietin secretion, there are some hormones like mainly thyroxine, androgens, thyroxines, also growth hormone, all these things. Some products of RBC destruction, they are called hemo. Whenever RBC is destroyed, erythropoietin secretion is induced. Products of RBC destruction are called hemosylates, HEMO or simply HEMO, SYLATES. Some nucleotides and vasoconstrictor, again vasoconstrictor drugs. You forgot about drugs now, but vasoconstrictor drugs, what will they do? They will constrict the renal blood vessels, leading to hypoxia in the renal cells. Then those renal cells which secrete erythropoietin will be induce. So, some vasoconstrictor drug, even if RBC counts are normal, some vasoconstrictor drugs, if they are administered, then they can induce erythropoietin. So, those are the factors affecting erythropoietin, but mainly hypoxia, also alkalosis means increase in the base composition of blood. If there is, that is called alkalosis. Acidosis is increase in blood acidity, alkalosis is increase in blood bases. So, if there is alkalosis, or it has been seen some cobalt salts, some beta adrenergic stimulus, you will come to know of this term when we study the adrenergic and cholinergic physiology. So, mechanisms, beta adrenergic stimulants, adenosine, these things facilitate erythropoietin secretion, but mainly it is the primary factor is hypoxia. Again, only one hormone which is known to sometimes decrease erythropoietin secretion is estrogen. Okay. So, one cause which is attributed to somewhat lower RBC counts in females than the males, because estrogen is primarily a female hormone. Okay. So, estrogen decreases synthesis of globin, depresses erythropoietic release to hypoxia. Some authors are telling one concept which is attributed to this finding, that RBCs are somewhat less in number in females than males. Okay. So, maybe 50,000 to 1 million less. So, hormones we have already discussed. Androgens increase erythropoiesis, they are directly stimulating the erythropoietin. Thyroid hormones increase metabolism. So, as such, increasing the metabolisms, all the body cells including the bone marrow cells, thus inducing erythropoiesis. So, hypothyroidism, whenever there is decrease in thyroid hormones in the body, some anemia may be there may be a finding of some anemia. Anemia is decrease in RBCs or hemoglobin. Okay, so hypothyroidism is associated with anemia sometimes. This is just a summary. Regulation of erythropoiesis, hypoxia, we have already told, erythropoietin, some factors which are influencing heme synthesis as well. So, some first class proteins, amino acids, some metals, iron, copper, which are related to heme synthesis, cobalt, nickel, proteins. Maturation factors, maturation of hemoglobin is also dependent on dietary factors like vitamin B12, folic acid, and one factor called the Cassell's intrinsic factor. I don't know whether it has been mentioned in the GI physiology classes till now or not. Cassell's intrinsic factor from the parietal cells of the stomach, they help in the absorption of vitamin B12. Okay, so indirectly they help in absorption of vitamin B12, as vitamin B12 is needed for at some stages of erythropoiesis. So, Cassell's intrinsic factor is also helping in erythropoiesis. So, these are maturation factors, but directly stimulating factors are most potent factors is hypoxia. There are some vitamins, some hematopoietic, other hematopoietic growth factors are other than erythropoietin. Among hormones, thyroxine is most mentioned, but some androgens also, and about the androgen hormones will be discussed when we discuss in endocrine physiology. Maturation factors, for the maturation of the already maturating RBCs, vitamin B12 and folic acid are required.